You guys were gracious, and last week, or maybe the week before, I saw a press release that showcased kind of where the hospital's been at financially and how things have been going here recently. And I really want to kind of catch up with Darius and you guys and talk about some of that. So Darius, I mean, could you help maybe further describe the current financial situation today at the hospital, and maybe compare that with how the financials were at the end of year 2017? So,
okay, sure, Ken. 2022, the fiscal year end, June 30, we just ended it, wrapping that up. Another improvement over the previous year, which was an improvement over the year before that. But even going back before, back in the 13 range, 12, this is a critical access hospital. So it was in the kind of the normal range, kind of a break-even type of situation. Then there was a downturn into 17 that you mentioned, Ken. We got down to about a $5.4 million loss in net income. It improved the following year by about $2.5 million. So we had a $3 million loss in 18. In 19, it improved significantly, went back up about another $4 million. So we were back into a profitability in net income. Then COVID hit. In 2020, we were fortunate enough, we received monies from the federal government. All hospitals did across the nation. So we were able to stay at that break-even range for the 2 years ended in 20 and 21 when we received those federal monies. In 22, we're back to essentially a break-even from operations even, which is very, very good for a critical access hospital because we're paid cost from Medicare and Medicaid. So there's not really a way to kind of increase profitability in a critical access hospital. So back to a break even in 2022. So that was an improvement over 2021. We're looking at ending the year right now at about 7.5 million net income. So back, very profitable year this year.
Okay. So Dr. Breon, there's been an influx of new services and things have been having more options for patients to be able to utilize the hospital here. So what vision is in place for the hospital going forward, not only financially, but to provide those community services, those needs, for all of us here in Mahaska County?
Well, I think, first off, to answer that question, I think even after just as providers, we're kind of happy to have coders and billers and a department that can collect our charges and submit those to insurance companies and then make sure that those monies get paid. And so in the past, I know we had struggles with that, and a lot of changes have occurred in the last 5 years within the infrastructure of the billing department and the coding department to facilitate that. Nothing more aggravating for a provider than to do a lot of work, provide a service, and then realize for whatever reason it maybe never got paid. And so we've tightened those things up considerably, and just personnel in those areas has been really helpful and good at establishing better practices for collecting the payments from insurance companies when we submit those charges. So that's been really helpful. And that makes providers happy to know that the work you're doing is actually going back to the hospital as an income. Secondly, I think one of the things that is attractive to providers, which is going to get to the point that I'll address finally, but the new electronic medical record, which we've had in place now for a year and a half, has made a world of difference in just the ability that we have to document things that we do for people to extract the information so they can code and bill off of that. And so that's just been a process that's much more efficient, much more complete, and also more accurate than we've ever had in the past. So that's made that process much more streamlined. Once again, very appealing to providers because you don't want to spend a bunch of time doing your charting and documenting, which we all have to do, and spend an inordinate amount of time doing, and then realize that it's a challenge for everybody else to take that information and get anything meaningful out of it for both patient care, but also for financials to code and to bill and to get insurance payments and patients' payments for the services that are provided. And then the last thing I think, and I mentioned providers are they find the electronic medical record that we have, Epic, very appealing. But there's been lots of things about the facility that's, I think, been increasingly appealing to providers that are looking for a place to work, and also for the providers that have already been here. And that doesn't go for just providers, but also for nursing staff. We're very fortunate to have nursing staff areas fully staffed for the most part all the time, so that we don't have any inhibition to care for patients because of a lack of nurses to provide the care. And so having fully staffed nursing care, having providers that are happy, and having a place that's attractive for providers to come and work. We've got more providers here now than ever providing care in a broader variety of areas than we've had. And those people seem to be very happy doing the things they're doing, working with the care teams to do that. And so all those things together, it's just really an attractive opportunity for providers, for care providers, care teams, nurses, and everybody to get to work together. It seems like everybody's working together now. And so that just opens the door for patients wanting to come and get their care here because they sense that. And so, we have a vision for service lines to expand as much as we can within the realm of what can a critical access hospital do effectively and efficiently, recognizing those services that we can't provide and get those to the correct places for that, which is also good for patient care. And then having a bunch of providers and nurses that are really excited about taking care of patients, more so now than ever, I think, here at the hospital.
I was going to say, you've provided a very thorough answer there, and actually most of that covered my next question. But do you think that those key elements that you spoke about, the billing and the patient care and the amount of services, are helping to drive up the numbers of patients and the level of satisfaction that people have with the hospital?
Yeah, yes, and yes. I think the demand for services has increased, not only in our community but in surrounding communities. So, as medicine advances, there is just a greater demand for access to those advancements, and we try to meet the needs of those things. So we try to supply the services that those advancements allow us to do. At the same time, there are hospitals that have been challenged in our corner of the state. And lots of rural hospitals are really challenged right now trying to do the things that I've just told you that we've been fortunate enough to do for a variety of reasons. And there's so many people that could take credit for that. And it's a big group of people that have really invested a lot of time from the top all the way to the bottom to be in a position to do that. But unfortunately, for whatever reason, there are lots of other hospitals, especially in the last several years, and COVID didn't help that at all, that haven't been able to do that. So because of that, we see people coming here from even other communities because we're trying to provide those services to rural areas around us, and it's really increasingly hard to get into tertiary care centers. So I think that's also maybe driving our numbers up some, and being an appealing place for people to want to come and get their care at a time like that. It's just a great time to be able to provide services here. I wish every town in Iowa could have the kind of hospital that we have. Unfortunately, they don't, and so somebody needs to provide that care when we're open and willing to do that for anybody that would come and trust us for the care.
Well, Darius, I'd like to touch a little bit more on navigating the pandemic financially for you, because you're probably watching those numbers during the pandemic, and somehow you're still here with us today and you didn't have a heart attack. So there was a lot of limitations that came on that money. I mean, anytime you have government money come in, there's can do this, can't do that. And I read over the audit report, and there was a small notation that said that there was some usage of government money that maybe not had been the intended use. And that's not unusual. As a reporter, I've read the same sort of thing over and over again from many different government entities. For you guys, how did you solve that and work that out to make that whole?
Yeah, as you mentioned, Ken, when you get government money, grants or anything from state or federal government, there's always strings attached. You have to make sure you spend it on expenditures during the period, and that they're qualified expenditures. And during COVID, that was COVID supplies. It could be anything from PPE, personal protection equipment, gloves. It could be staffing, additional staffing needs, and other costs, reductions in revenues. So when we initially reported that information, there was a few dollars that were paid in the period, but they actually applied to a previous period. We had more than enough costs in total to cover the actual reimbursement that we received. So there wasn't any big issue about that, small few dollars. A couple invoices that got paid in like a January when they were really for December services. So when they pulled those out, we still had plenty of room to spare for the cost to cover the monies we received from the federal government.
I was going to say the audit report didn't make a big note about that. It was just kind of.
It was a relatively small. I think it was less than $50,000.
Yeah.
And we had way more than that to cover that.
So we talked about the financial challenge a little bit that COVID brought for the hospital, and not just this one, but I think almost everybody. News industry, I can speak for my industry. We lost a lot of our fellow media outlets during that time. But today, things are looking a lot more financially strong. I saw quite a positive number in the latest audit report. I think maybe I'm hearing projected that things are going to improve even further.
It's even further this year, and we're budgeting for the following year, 2023. We're actually budgeting a higher operating margin. And operating margin, again, like I said, critical access hospitals, it's extremely difficult because you're paid your costs. So you can increase revenues, but if you increase revenues, that cost gets allocated to lower revenues. So you're really not going to make a lot of money in a critical access hospital by reducing costs. And our Medicare and Medicaid percentage here is about 65%. That's over 2/3 of our patients are for Medicare and Medicaid that we get paid cost. Our Blue Cross contract that we have here also is tied into that Medicare reimbursement methodology. So to make a small profit here at Mahaska is a great accomplishment, and we're budgeting for that in 23.
So I'm hearing both of you talk about some very positive things. The community has expressed some concern that potentially the hospital is going to merge with somebody else. Are you seeing that as a feasibility, financially, provider-wise, anything like that? Do you see that in the future for this hospital?
No, I don't see that for this hospital in the near future, no.
Okay.
No, and I would add to that, I'm not sure why that rumor always travels around, but I think if you look around, there are a lot of facilities that are Mercy or Unity Point affiliated. And, I don't think an affiliation with a bigger institution is a terrible thing if you do it for the right reasons. And most of it's just been because everybody's struggled, like I've already mentioned. I think way down the road in the future, we may have bigger hospital systems and everybody may be affiliated with somebody. But we would never affiliate with anybody unless it would be beneficial for our community and for our patients. And that would only be something when somebody would realize what we're doing and how that would be a benefit to them. So in the meantime, we're independent. We can work with other hospitals as we need to, and there is really no benefit to us or our patients to do that at this point in time.
Yeah, I would agree with that, and I would just tag onto that to say that a lot of hospitals, smaller hospitals that integrate, is because they can't provide the services to the community that they need to provide or is demanded by the community. And if you can provide those, and we've recruited very, very good here and have a lot of services to offer the community. But a lot of those other smaller ones, they want to provide the access to the services in their community. So one way they get that is getting visiting physicians coming in to provide services. But we have a very good, excellent recruitment here at Mahaska. So it's got a lot of physicians here.
Very good. Have I missed anything, gentlemen, that maybe we should have touched on? I always like it when everybody goes, no, because that means I did a good job. But so I appreciate you guys' time. I know you're both very busy folks and helping answer a few questions I had. So,
well, thanks again.
Thank you. Stay cool. So we're here today. We have Dave Langkamp. He's the president of the board here at Mahaska Health, and we have the CEO Kevin Durande, and we're going to talk a little bit more about a press release that came out, and we're going to dig into that a little bit more, and we're going to get to kind of learn Kevin a little more. You've been here, what, 4 years now?
4.5 years,
I was gonna
yes.
say, so we should have gotten to know you pretty well by now. So tell us a little bit about yourself, if you don't mind.
Yes, I grew up on a farm just north of Pella, and so really enjoyed the opportunity to not only work in healthcare, but to help my parents farm. So we have grew up on a grain farm, and then we used to have a farrow to finish hog operation. We used to milk, and so really enjoyed the area, southeast Iowa. And so started my healthcare career at Vanderbilt Medical Center in Nashville, and then moved back after my dad's second cancer. So thankfully he's a 4-time cancer survivor and doing very well. And then worked at Unity Point and Des Moines Orthopedic Surgeons, but really enjoy the Oskaloosa community and helping my dad as well. So,
Let me
yeah.
say, you get the best of both worlds. You get to be part of the farm and be
right.
part of the community as well. So, I mean, kind of help describe a little bit of your leadership style, because I think that maybe is a big factor as to where Mahaska Health is today.
Yeah, one of the things when I came in 2018 is we reversed the organizational chart. So the board, myself, our leadership team, we're at the bottom. And so all of our people are at the top. And so we have what's called uplines. And so we're also a physician-led hospital. And so we have our physicians and providers serve on our committees. They serve on our leadership team. And so they do a great job of having a say in the type of care we provide here. So my leadership style is more from how I grew up on the farm and just doing the right thing and taking care of folks, closing the loop, and supporting our team. And so anybody has a say in what we do here. And so just thankful for our people and our care teams and what they do and how they work 24/7 to take care of this community.
I was going to say, I've talked with several different team members of the hospital, and they often mention how you'll pop in, say hi, you know most everybody by name, and you do listen to those. So is that kind of also part of your leadership style, is to take that input from others?
It is. You know, we're 24/7 here, so stopping in on the weekend or middle of the night, you know, we'll do town halls for nurses at 2 a.m. because that's the best time that we can get a hold of our night nurses on the floor, right? And so, yes, you pick up things in talking with your frontline employees, and they have great ideas of things that we can improve. And so we make sure we bring that back, and we close the loop on those items. So it's fun to have a team where people want to share, they want to move things forward, and work as a great team. So, yeah.
I was going to say, and I've seen this personally, and I've seen it with other CEOs, business owners, an ownership of what goes on. So I've seen you pick up trash out front. I've seen, you know, you and the leadership team serving meals to others or making sure somebody has a bottle of water. I mean, those kinds of things. Does that also, do you feel, contribute to the success, the culture, maybe the growth here at Mahaska Health?
You hit a great point, Ken, the culture. Culture is everything. And just this last Friday, we had 4 food trucks on site, you know, so it's free food to our employees and local police and fire. And we're all in a team together. And so the more we can serve each other, the more we can focus on the patient. But culture is a big deal. We take care of each other, and we look out for each other, and we make improvements. Good things happen. And so it's been a lot of fun to have this team and really buy into the culture that we have here.
Well, and I'm going to swing over here to Dave a little bit, and if folks aren't familiar with you, you've been a long-term member of our community, a business owner, and a leader. Can you maybe describe a little bit more about who you are and why you take such an invested interest in Oskaloosa?
Well, as a funeral director in this community for 40 years, I think it's important that we do invest ourselves in something like a hospital. You know, I've told this story before, and Kevin's heard it, the executive team has heard it, about Iowa State University. They did a study about what was one of the important facets of a vibrant community under 25,000 people. And the first thing it started with was a vibrant hospital. So if we are able to maintain our independence and continue to expand our service lines and make this hospital serve the community to the very best of its ability and also be prosperous, the entire community and surrounding area wins. So that's why I'm involved in this hospital. I want to do everything I can possibly do with Kevin and his executive team just to make sure that this is a vibrant hospital.
I was going to say, so you have a few new members on the board that you've been working with, and so I mean, I'm kind of leading into, there's, of course, some board members. What's your vision? What's your hopes for helping to support the hospital, bring it, to that next level? Because, I had the doctor and the CFO here just a bit ago, and they talked about some solid financials that are taking place, but it needs vision and leadership. And so, you as a board, what do you see you guys' vision for our hospital?
Well, recently there was 3 new board members that went on the board. Their responsibility is to understand how the hospital functions and how we can best give the tools necessary to the physicians, to the medical staff, so that they can best provide whatever services that might be. And as trustees, we want to provide to our people the very best that we can. I think that's one of the huge responsibilities. We're here to help make decisions along with Kevin about opening up new areas, whether that be in radiology, urology, maybe advanced cardiac care, but again, to supply all the needs that are necessary in our community.
Well, it kind of dovetails into, what's the difference between Mahaska Health? We now have 60 plus providers. There's, the physician leadership that seems to be pretty strong. Kind of give us an idea of, how this is all dovetailing and to provide, for our community a little bit.
Well, Ken, answer your question, we're just continuing to bring in really good people that have a passion for patient care, and they fit our culture, right? And so they enjoy working well together to take care of patients. They communicate with each other, right? But if you look at our website and our leadership team, you'll see our medical directors. And those individuals have been placed in those leadership roles to really make sure that they focus on proper care, bring the care teams together. They lead new initiatives. If we want to bring on new service lines, we consult with those provider leaders and physician leaders to make sure that that's something that's appropriate for Oskaloosa and our community and for our patients. And the other piece too, from a recruiting perspective, is in 2018 we put together a 10-year recruitment plan. And so we're talking to high school students, college students, medical students who are getting ready for residency, right? We're talking with them. If they grew up in Oskaloosa or their surrounding area, they're job shadowing, they're hanging out with our providers during the summer, right? And so we're in discussions with them about what it would look like to work at Mahaska Health.
Ken, what I also think about having 60 medical providers here on staff is we are able to provide more one-on-one time with patients. None of our physicians are overwhelmed with, boy, I got this many patients that I've got to see today. So I think there's more one-on-one time, and I think that would be important for a patient. I also like the fact that, we developed urgent care where people that come in maybe with sore throats or just not feeling well or maybe flu-like symptoms, they don't have to maybe take up time in the primary care area. They can get diagnosed in that urgent care area, and there's more time for the primary care physicians to maybe treat more complicated cases. So I think that's a plus for our people.
Well, and that walk-in clinic is 7 days a week, which
Right.
is really nice, so that people don't always have to go to the ER as well.
Right. Yeah.
So.
I was going to say, a nice addition for that is being able to sign up and have a time that's assigned to you, and you can wait in your car if you feel most comfortable there.
Correct.
Right.
And you can be alerted as to, hey, you're next in line.
That is a nice system for
Yeah.
the patients, so yeah.
Because you don't have to sit in a waiting room with a lot of sick
Correct.
people, right?
Correct.
Yeah, you can almost schedule your time and say, okay, I'll be there at 3 o'clock, and you almost walk out of your car and walk in that door.
Yeah, and those might be small items, but is that the type of visioning that folks are talking about, or you guys are working towards? Is making it the most convenient that you can for your patients.
That's exactly right. Those are things that we implemented because we've heard from our patients, right? We've heard from our providers, like, hey, is there other systems out there to better accommodate the patient? You know, just a few years ago, we didn't have a patient portal or to be able to schedule an appointment online, and now we have those options where patients receive their lab results on their phone. They can schedule an appointment online. We have same-day appointments, so if you wake up and something's going on, you can walk in same day and see one of our providers.
That complexion is changing, Ken.
Yeah.
How we care for the patient is truly changing, and I like to think that we're pretty progressive here. We're willing to walk out there and say, all right, that sounds like a really good idea, let's try it.
So do you think that vision is translating to the bottom line of the hospital? Because we saw that,
Yes.
you know, in that press release.
Yeah, most definitely. I think, you know, when you expand service lines, right, and there's service lines where you have great people in those positions, the best marketing is what happens in the exam room between the patient and the provider. And so we have providers that truly care about patients, they're kind to patients. And so when you expand those service lines with those types of individuals and how our care teams are working together, great things happen, and that's why you've seen our financials increase.
Kevin, our OB department, look
That's
how that
great.
has grown.
That's exactly right. We have 6 family practice OB providers now, and our 4 new OBs that have joined us, just doing a fantastic job, and their practices are growing. And it's exciting to see that. When 7 towns around us have closed OB and we're able to grow that because of those great providers,
Right.
It's exciting to see.
Yeah.
I was going to say, I've had the privilege of speaking with several of them before.
Yeah.
So do you see that, of course, then, according to the audit, you guys have grown financially, you're more stable. I think COVID probably scared everybody, you know, because those were pretty hard on numbers. They made a lot of things red versus black.
Yeah.
As those numbers improve, do you see that the continued reinvestment back into the hospital and providing those things then?
Most definitely. Darius and I and our executive team and providers, we bring capital items to the board. We have a finance committee, right? So we discuss those items so that we can reinvest into not only equipment, but our people as we move forward here at Mahaska Health. Yeah.
You know, Ken, during that COVID time, we continued to pay all of our people. We did not lay people off. Our business was down 57% during that time, but we managed to go through that. And I think because we were really good with our people, I think it has brought about blessings to us in that the business has really been good to us.
Well, and if you can address, I think this will probably be somewhere where I'll wrap up, because I think everybody always wonders this in the community. Is there going to be a merger, or is Mahaska Health going to close? I mean, any of this.
No, we're not, Ken, we're not going to close. We're doing very well because of what our people are doing every day. We're in no discussions with a merger. We're an independent, physician-led hospital, and thankful for our leadership and our board of trustees, but most importantly, what happens in the exam room every day with our caregivers and our providers. It's an amazing team.
I completely concur with Kevin, representing the Board of Trustees. We have no intentions of merging. We're not going to close. I think we're on a really strong path. I feel really good about what we're doing here.
That's right.
Well, I was going to say that in all of my years of doing this, the closest that we can have to leadership to a service or a community service like a hospital, the more local people we have in control of that, the better our community is served.
Absolutely.
So that's good news to hear. So have I missed anything, gentlemen?
I think you've been pretty thorough today. I think it gives our community a broad overview of, hey, we're doing well, we're going to be here, and we're going to serve you.
That's right. I'm excited about some of the new service lines that we're looking into, whether it's cardiology or dermatology. Those are some areas that are a huge need. So we're excited about the future, and we're continuing to evaluate what options would benefit Oskaloosa residents and the surrounding communities.
All right. Thank you for your time.
Thank you, Ken.
Thanks, Ken.